Hello everyone, I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty. Today we will study a important topic of renal artery stenosis. So, renal artery stenosis is nothing but the narrowing of one or both of the renal arteries, okay? As a result of which, what will happen if there is narrowing of arteries? There will be a reduced blood flow to kidney, right? There will be a reduced blood flow to the kidney. Obviously, if, like I have told you many of the times, if there is a four-way and the traffic of four-way is getting converged to a one-way, what will happen? There will be a narrow space and it will be very difficult for the people to move, right? There will be a lot of traffic. Similarly, if in our blood, if in our urinary system, if in our kidney, there is narrowing of the arteries, what will happen? There will be obstruction, as a result of which it will lead to the further pathologies, right? So, if I talk about the epidemiology, then 5% cases are due to the hypertension. It is commonly in elderly peoples and those people who are with atherosclerosis. Etiology is 70 to 80% due to atherosclerosis, 10 to 20 is due to fibromuscular dysplasia and others like Takayasu arteritis and trauma. And you have to tell me, that is Takayasu arteritis a large vessel vasculitis, medium or small? You tell me or should I tell you? Okay, I will only tell you. It is a large vessel vasculitis and it is also called as the giant cell arteritis. Okay. And now it's your homework to revise the whole Takayasu arteritis, okay? What is the pathophysiology involved? There will be a decreased renal perfusion. There will be a decreased renal perfusion. As a result of which, what will happen? There will be a activation. Activation of what? There will be a activation of the renin angiotensin system. As a result of which, if there is an activation of the RAS system, there is one thing that we know that will occur. What? That is hypertension. Plus the ischemic nephropathy. Plus the ischemic nephropathy. What are the risk factors? The risk factors you have is the smoking, diabetes, dyslipidemia, hypertension, and people who are at the age of more than or equal to 50 years. So, age is a risk factor. Then we have seen smoking is a risk factor. Diabetes is a risk factor. And whenever we are talking about diabetes, you have to revise the diabetes criteria. What are the clinical features? There will be a resistant hypertension and abdominal bruit. You will be able to hear what are abdominal bruit. Bruit are nothing but the sounds, the abdominal sounds that you are able to hear. There will be worsening of the renal function, the renal functions worsens, okay? And there will be pulmonary edema. There will be pulmonary edema. These are the things that will happen. What are the investigations you will order? So, for the investigation, you will order the Doppler ultrasound, CT angiography, MR angiography, and renal arterioangiography. In the Doppler USG, it is non-invasive and it evaluates the velocity, that by how much velocity the blood is flowing. Okay, it detects the velocity of blood flow and it detects 60% of stenosis. 60% of the stenosis can be detected by the Doppler. Then you have the CT angiography. It is excellent for the anatomical details. Like it can be used if the patient is suffering from the chronic kidney disease. MR angiography, it is good for the soft tissues. Non-iodinated contrast is used and useful in patients with renal impairment. Gold standard is renal arteriography. Okay, it is invasive and it has a diagnostic and therapeutic potential. What are the complications? For the complications that can occur, there can be ischemic nephropathy, there can be CKD, there can be heart failure, and there can be refractive hypertension. See, if you are not able to recall anything, and if that is a question of kidney, that is a question of renal system, blindly remember the complication will be hypertension. Okay. What is the management? So for the management basically depends on the cause, severity and the kidney function that we are dealing with. So for the medical management, you will give the antihypertensives like your ACE inhibitors and ARBs, statins, antiplatelets, and you will ask the patient for the lifestyle modification. Interventional option are angioplasty with stent placement. You can offer that as well to the patient. There is surgical revascularization and it is done rarely. So you have mainly the angioplasty with stent placement. Okay, you have angioplasty with stent placement. What are the indication for intervention? If there is resistant hypertension, if there is recurrent pulmonary edema, and if there is progressive renal dysfunction. Next, you have the fibromuscular dysplasia. It is seen in young females. So remember fibromuscular dysplasia, F for F, like F for females and F for fibromuscular dysplasia. Appearances, you are able to see a string of bead appearance like this. This is nothing but a what? It is a string of bead appearance that you are able to see in the imaging. So fibromuscular dysplasia, F for F, it is seen in the female and you are able to see a sting of bead appearance. Then you have the atherosclerotic areas. It is mainly seen in the older males, and it is seen in the proximal part of your renal arteries. Renal artery, proximal part, and often it is bilateral. So remember the three things. Elderly male it is seen, bilateral and proximal. Bilateral, proximal and elderly male. So what is the prognosis? Prognosis mainly depends on the diagnosis. If there is a late diagnosis, it will obviously lead to a chronic kidney disease, and if the chronic kidney disease is also not treated, it will end up to a end stage renal disease. Okay, so the prognosis is this. Summary: the renal artery stenosis, it is an important cause of secondary hypertension. It is an important cause of secondary hypertension and it requires early detection. So these are the summary points that you need to keep in mind. What are the investigations we do? What are the clinical features we have seen? Right? What are the risk factors you have? What is the pathophysiology? In the pathophysiology, just remember that there will be a renal perfusion, as a result of which there will be activation of the RAS system, and whenever the RAS system is activated, the person will 200% sure it will have hypertension. This much you need to remember. Okay, I think we are good to go to the next topic. We are done with this chapter. If you are having any sort of doubt, please feel free to ask me. Please feel free to DM me. Thank you so much.